If you could run through a list, another general question, but there seems to be an epidemic, especially with women, of fatigue, just chronic fatigue. And I know this is one of your specialties. So if you could run through a list of possible causes of chronic fatigue and first steps in diagnosing and treatment.
Another broad category here. Like I said before, low thyroid can cause chronic fatigue, and that's an epidemic these days. So take the temperature, the oral temperature in the afternoon for 5 days in a row and make sure it's not running below 98.2. The range should be 98.2 to 98.6. Then get a complete blood count, make sure you're not anemic, and even an iron panel, because sometimes people are borderline anemic. Make sure their vitamin B12 and folic acid are checked and be near the upper range of normal. There's a mutation called MTHFR mutation where people have trouble making folic acid, the methylfolic acid. So that test should be done since 4 out of 10 of us have this mutation. And
4 out of 10?
4 out of 10. Autistic children, it's around 95%. There's actually around 60 of these mutations, but MDs can only check for 2 of them, the most common ones.
Can you expand on the MTHFR gene, especially for people with depression that maybe didn't know they had this gene, and a simple fix that could...
Well, when they have the MTHFR gene, they're more likely to have anxiety disorders, depression, all kinds of psychological problems. And instead of being on a drug like Prozac or Valium, it's better just to try to treat the cause and put somebody on methylfolic acid and methyl B12 and see how they do. Sometimes they might need dimethylglycine or trimethylglycine or some other supplements with this. With chronic fatigue, people are low on minerals all across the board, so you need to check red blood cell minerals, not serum, and you can do a hair analysis. I like Dr. Static Company in Chicago. That's real accurate hair analysis, and usually have a 95% correlation with their hair analysis and low red blood cell minerals. So we're all low on minerals. We have too much sugar in our diet, too much corn syrup, so we really want to eliminate the mineral aisles at the grocery store, like I said before. And you need to do complete blood work, and some people even have autoimmune diseases, so you need to check an anti-nuclear antibody. It's a blood test that checks for autoimmune diseases. Look in their mouth, make sure they don't have any mercury, amalgam, dental fillings, or root canals. Those are other causes of fatigue. And we're being bombarded with all kinds of chemicals these days, so we have to detox by doing the sauna, the infrared sauna, and even getting some EDTA and DMPS chelation, just to help detox our bodies, because our bodies can't keep up with it anymore. We have too many poisons in the environment.